Welcome to our deep dive into the complex world of cancer. Today we'll explore the different types, causes, symptoms and treatments of this multifaceted disease. Understanding cancer can feel overwhelming, but knowledge is power. By learning more about this disease, we can empower ourselves to make informed decisions about our health. Let's begin our journey to better understand cancer and the impact it has on our lives. Cancer is not a single disease, but rather a collection of over 100 different diseases, each with its own unique characteristics. These diseases are broadly categorized by the type of cell they originate from. For example, carcinomas, the most common type of cancer, begin in the epithelial cells that line our organs and tissues. These include cancers like lung, breast, and colon cancer. Sarcomas, on the other hand, develop in connective tissues like bones, muscles, and cartilage. Lymphomas and leukemias are cancers that affect the blood cells and bone marrow, responsible for our immune system. Each type of cancer behaves differently, spreads at different rates, and requires specific treatment approaches. Cancer arises from a complex interplay of genetic and environmental factors. Our genes are the blueprints of our cells, and sometimes these blueprints contain errors or mutations that can increase the risk of cancer. These mutations can be inherited from our parents or acquired throughout our lifetime due to various factors. Lifestyle choices like smoking, excessive alcohol consumption, and a diet low in fruits and vegetables can damage our DNA and increase cancer risk. Exposure to certain environmental toxins like asbestos and radiation can also contribute to the development of cancer. It's important to remember that while some risk factors are modifiable, others are not. Cancer can manifest in a myriad of ways, and the symptoms often vary depending on the type and location of the cancer. However, there are some general warning signs that should never be ignored. Unexplained weight loss, persistent fatigue, and persistent pain are red flags that warrant further investigation. Changes in bowel or bladder habits, such as constipation, diarrhea, or blood in the stool or urine, should also be checked by a doctor. Skin changes, including new moles, sores that don't heal, or changes in the size, shape, or color of existing moles, can be early signs of skin cancer. It's crucial to remember that early detection is key in cancer treatment. If you experience any unusual or persistent symptoms, don't hesitate to consult your healthcare provider. The treatment landscape for cancer has evolved tremendously in recent years, offering patients more options and hope than ever before. The specific treatment plan for each patient is tailored to their individual needs and depends on factors like the type and stage of cancer, overall health, and personal preferences. Surgery, a common treatment modality, involves removing the cancerous tumor and surrounding tissues. Radiation therapy uses high-energy rays to destroy cancer cells or slow their growth. Chemotherapy, often delivered intravenously or orally, uses drugs to kill cancer cells throughout the body. Targeted therapies are a newer class of treatments that specifically target the molecular pathways driving cancer growth, offering potentially fewer side effects than traditional chemotherapy. Immunotherapy, another groundbreaking approach, harnesses the power of the body's own immune system to fight cancer cells. We've covered a lot of ground today, but I'm sure you still have questions. That's why I encourage you to leave your questions in the comments below. Would you like to know more about a specific type of cancer or treatment? Are you curious about the latest advancements in cancer research? I'm here to provide you with accurate and reliable information. Remember, knowledge is power. Thank you for joining us in this informative session about cancer. Remember, early detection and treatment are key. By staying informed about the different types of cancer, their causes, symptoms, and treatment options, we can take proactive steps to protect our health and the health of our loved ones. Remember, knowledge is power, and by arming ourselves with information, we can navigate the complexities of cancer with greater confidence and hope.